So how do you cure a trapped nerve? I'm Trishul Vadi, I'm an osteopath and chiropractor, one of 3 people in the UK qualified in both professions and clinical director here at AVID Clinic. So in this video I'm going to tell you about what a trapped nerve is all about and how we can resolve it. Of course, like anything, if you want to really cure it, let's think about the word cure. See, we think about cure as if most of the time resolving the symptoms and feeling better. But actually, does that mean that we've actually dealt with the underlying condition? Well, that's something that we want to ensure that we do so that we get the long-term benefits and make sure this doesn't come back again. But more importantly, it doesn't hinder our personal lifestyle goals, be able to do all the things we want to do. So first of all, we're going to find out what the cause of the trapped nerve is and find out where the nerve is being pinched and impinged and causing the problem through there. And there's a number of reasons why that could be. It could be to do with muscle joints. It could be to do with muscles, it could be to do with joints, it could be to do with inflammation, it could be to do with a whole bunch of stuff. In fact, recently I had a patient who came to me and said, do you know what, all they had on their little finger, on their left hand, all they had was a sharp pain that would occur around 4 a.m. in the morning, approximately. Now, it would also occur at various times during the day, but predominantly 4 a.m. it would wake them up with this really, really excruciating pain in the finger. Now, the long story short, what I did with them was I went through the full case history, found out what the source of it is, and lo and behold, after doing a series of tests, we found that when you looked at the spine and we tested the nerves up here in the neck, we found that there was an impingement right through here. All it needed to do was to have an adjustment to release the pressure off these nerves, which ultimately end up going into the finger, and that took that pressure right off. Now, in the very initial stages, that gives them immediate relief. However, the long-term solution is to find out why was that one joint causing that one nerve to be pinched in this one person? Because the question is it to do with their pillow? Is it to do with the mattress? Is it to do with the way they're sleeping and all the rest of it? And my argument and my question always is, well, if everybody else did the same thing as them, will they get the same symptoms? Not necessarily. So we have to keep delving deeper, going a bit like a detective, finding out what else is going on in that person's life that might be causing it. It also turned out in this particular case that they weren't breathing correctly throughout their normal 24 hours. So they wouldn't use their abdominal diaphragm as much as they should do. And so using the neck and shoulder muscles much more, so really contracting through here. That ended up meaning that all these joints were being constricted much more. Their neck movement wasn't working so well, and that led to all of it. So ultimately we had to handle how can we re-engage the normal breathing patterns in this patient to make sure we can then ensure that the pressure of the joints in the neck aren't as high. Now, that's just one example. There could be so many different examples of why that can occur. You know, we have patients who have, like bus drivers, for example, quite commonly, they've been sitting at the bus, driving these buses for many hours a day at a time. And because they're using neck movement, twisting just the one way to collect the fare, and then carrying on, they're getting this repetitive strain type injury. And that's also important to ensure that the rest of the spine is nice and flexible to reduce any compensation patterns occurring in the neck. So if you want to know more about this, please do let me know in the comments below. I'll be happy to answer any questions that you have. Feel free to send me a direct message as well on any of my channels. And also, please do leave me a like or a thumbs up. Hope you enjoyed.